Welcome back to another episode of Talking Team CBT. Too bad Daniel can't be here, so you're going to have to just listen to me. But we have Sunny here with us today. He is a former high-tech employee, an immigrant. He's LGBTQ person of color, and we're super excited to have you today, Sunny.
Thank you, Angela. Nice meeting you again.
Yeah. So why don't we usually start these with telling us a little bit of how you got involved in team, like what got you interested, what got you started?
Well, Team CBT, this is my second or actually third career. So I started a little bit over 11, 12 years ago. And when I graduated from my master in social work, I thought that I needed uh, additional clinical training. And so I went to Dr. David Burns' 2-day class on anxiety. I think it's called, I forgot what they call it now. Yeah,
Some
it's
kind
an
of live
anxiety.
class that he had, right?
Yeah, yeah,
Yeah.
yeah, and I was very excited about what he's teaching, and he invited me to his Tuesday group. So I start learning from him, and fortunately, because I end up working for the medical office, and they have a lot of people and referral to me same day. So I was fortunate to learn a technique that is very fast healing and time limited, so that I can see lots of patients. And I also got to practice a lot of Team CBT as a result. So I was very fortunate of that. Yeah. And then I got to be friends with David and do some personal work and kind of got a lot of uh, great benefit from it for myself. So I'm all into Team CBT. Yeah.
Yeah, I think once we experience the personal benefits, you're right, we get all in. I mean, that seems to be one of the best motivators to use it in our clinical practices when we have that healing for ourselves. Maybe you can share a little bit about what that was like for you and your journey.
So I always have a lot of anxiety and panic attack when I was younger. I don't know, probably for many different reasons, different trauma, including being an LGBTQ person of color. Uh, so I'm maybe not loving my career too. So I ended up getting a lot of panic attack. So I know about David's book, Feeling Good. So
Mm-hmm.
it was quite useful, helping me. Uh, and that started my journey into self-exploration. Uh, and in uh, eventually I got a lot healed, got a lot better. So I wanted to help other people, especially people who I can identify with.
Mm-hmm.
Uh, yeah, especially a lot of people of color, Asians, tech folks. Uh, Dealing with them is a little different because the thinking pattern and belief systems and the culture may be a little different. So I want to
Mm-hmm.
be there for them and help them through their journey because I went through a tough one. And if there's anything that I can help to make it a little easier for them, it would be my privilege. Yeah.
Yeah, I can only relate on part of that. Obviously, there's a lot of different factors you were talking about, but one of those is being really analytical, and I'm a little on the spectrum. I love computer programming and
Hmm.
video editing and math and science, and I never thought I'd get into any of this touchy-feely stuff. I'm like, oh no,
Yeah, yeah,
I can't
yeah.
do any of that. No, no. And so you're right, the tech brain is quite different, and we do approach things, and David's approach works for both. I mean, we've had people on who have a humanistic theory background and very emotional, connected, and relational, but also works for some of us who are task oriented and very analytical. You mentioned it was a tough journey. You tell us a little bit about that.
Uh, well, I grew up having a lot of panic attack and not coming out till I was 30 years old.
Mhm.
Uh, I was Catholic and Asian, and there's a lot of stigma against that.
Mhm.
So I think probably, and I don't, and I end up doing a job that I don't love. I like tech, but I don't love it, and I always like
Mhm.
connecting with people. I love people. So uh, when I so there's probably some hidden emotion about not wanting to do what I'm doing. So so my brain probably there's a lot of sadness and anxiety of those emotions. And it was hard to deal with and probably create this pattern that I'm not good enough, that type of
Mhm.
thinking
Mhm.
pattern. So it was a big journey with so doing CBT definitely helps, and I also do a lot of meditation, so that
Mhm.
also changed my life journey too. So yeah, so it was a difficult journey, but uh, end up learning a lot from it and able to use it for my current life, current career. So, do I regret doing it? No, I didn't regret that journey. Kind of helped me um, to where I am now. Uh, would I go back again? Probably not. It was very painful.
Yeah, that's probably wise. You don't need to relive it.
Yeah.
For sure. It's interesting you mentioned meditation. We had Dr. Jacob on and he talked about that. And so if your listeners want to hear more about that, they can go back a couple episodes.
Uh-huh.
But this, having this a lot of, like you say, sadness and anxiety and not feeling good enough, and what a tough journey. But it sounds like your love of people helped also, along with your personal journey. You mentioned something called the hidden emotion. Would you tell us a little bit about that? What was the hidden emotion like for you? I know that's a tool. I'm not going to be cheeky and say what is that tool, but maybe you can explain to our listeners a little bit about it.
Uh, it was just when we feel anxiety or being or sad, and currently, but it Dr. Burns talked about there must be something currently that I'm refusing to face or resolve that is causing it, that may have nothing to do with what I think is happening.
Mm-hmm.
So I don't think the coming out thing is a hidden emotion, but definitely a lot of since I don't think I was good enough, my behavior would be very automatically be very nice and accommodating to people. So
Right.
there's probably a lot of hidden anger and not standing up for myself, and not doing what I think I love to do, like like doing uh therapy. Like when I was young, I actually always thought I would love to do some kind of therapy, but I was
Oh.
told by my mom or other people, like even my counselor, that I'm really good at math. I should just do
Mm.
engineering. And then I was
Go
an
in this
immigrant.
direction. Yeah.
Yeah. So I end up like getting into electrical engineering, and I didn't like that. So I get another degree on management. I like that a little bit more because it has some to do with people.
People.
But there's a lot, I guess there's this hidden emotion that I that of wanting to please other people and doing uh what other people think I should be doing.
Hmm.
So
Hmm.
so the journey is to come out in different level and just be myself. So it's very helpful uh when I uh work with David during his hike thing. Uh yeah, about my approval addictions, yeah, which I think is he actually recorded in one of his podcasts.
Oh,
So
yeah.
so yeah, so that's what, yeah, my hidden emotions is. Yeah, maybe not so hidden eventually, but it was hidden
Right,
in the
right.
beginning. Yeah, yeah.
In the sense that not dealing with it, right? Because the hidden emotion is where something is bothering us, but we don't actually deal with it. We don't move forward. And sounds like, you were able to finally move forward and on your journey by expressing yourself and who you really are.
Yes, yes,
Yeah.
and I love it the way I am right now. I just do what I think is lovely for me. And if I want
Yeah,
to work 3 days a week, I work 3 days a week. And
sure.
if I want to see my friends, I see my friends. I can say no to people in general. Yeah. So yeah,
Yeah.
yeah,
Yeah. I mean,
yeah.
there's always little things that kind of trip us up.
Uh-huh.
Um, well, tell us, our listeners, what's one thing that has improved in your practice? Now, you had learned team before doing therapy, so you kind of started
Oh.
out the gate with doing team. Is that my understanding correct?
Yes, yes,
Yeah.
yes, yes.
Yeah. What's something about team that helps your practice? Like maybe pick, I know it's hard to pick one thing. I get a lot of resistance from interviewees to pick one thing, but what's one thing that's been helpful for you in your practice?
Yeah, that's hard. But
Yeah.
I'll pick the one that people may not say all the time because it's kind of routine, but the testing part is important. Yeah.
Mm-hmm.
I work in a medical clinic, so they do require testing. They have their own. They have PHQ-9 and GAD-7.
Right, right.
Uh, and especially with some population, you would not know how they feel without looking at those things, and you will not know the improvement because that certain population tend to be kind of downplay their emotions.
Mm-hmm.
Um, and symptoms. And there's a lot of physical symptoms, but yeah, so the testing would be important. Not also the testing include the evaluation of the session. So again, uh, certain population tend to look up to their therapist, which is a good thing. But when you want to make sure they heal properly, you want them to give you honest opinion, so
Mm-hmm.
that that person can be better. And of course, ultimately, it'll help me also as a better clinician. Yeah.
Yeah. And you
Yeah.
mentioned certain populations have trouble, expressing those. How are they feeling? Like, do you have certain forms or do you explain it a certain way so that they feel like they can be honest on the forms?
I just told them that this form uh, is for me and you to so that I can get better. So if you don't think that this is effective for you, please make sure that you fill out all the information. Like I have a patient who would never tell me how they feel about me, but then after doing that, he was able to tell me very detailed
Mhm.
in what way I can
Mhm.
that the therapy can be more effective, in what way he likes it. So uh, that really helps our progress. Also teach them how to be more assertive about their own
Yeah.
feeling
Yeah.
and thoughts, and yeah. So even with people who are considered authority figures, yeah, yeah,
Hmm. Hmm. And it's such a collaborative approach, right? Like you're really getting some give and take, and they're really getting involved in their own therapy.
yeah. And as long as they know that this is not a critique of me
Hmm.
personally, it's
Right.
just you know uh, honest opinion in like what you're saying, in a team way, in a collaborative way to get better. It's actually uh, uh, better to give feedback. In fact, I sometimes I would even nudge them. I wouldn't I actually would not like it if I only get all good feedback because uh we can always be better. Yeah, yeah.
Yeah, for sure. I've told some of my clients I get excited when you give me poor when not when you give me poor feedback. I get excited when my numbers are down a little bit because I know you're being honest, and that makes me feel good inside that you can
Mhm.
be honest with me, because I think that's as important as anything else moving forward. And
Yeah, yeah. And
I
I
don't
have
need
patience.
perfect scores. I got big shoulders.
Yeah, I don't need perfect score too. Like I know I'm not perfect, so how could
Yeah,
that
me
be
too.
perfect score?
Yeah.
Yeah. Like perfect score, I guess you if you do all the technique, you technically can be perfect, but not really. Yeah, I mean,
Yeah, I
like
think
care
imperfect
and
is better.
love, those are not very, you can't not measure those things, right?
That's right.
Caring, compassion, and love, and I think uh trying to achieve that is not being realistic. Yeah.
Well, it
Oh,
helps us to always attain some more growth. If we think that there's only
yeah,
the end goal, if we think, oh, I got a 20, I'm fine. For those of you that don't know,
exactly.
yes, a 20 out of 20 is good empathy. So, but yeah, there's always room for growth. You talked about certain clients and certain populations. Are there certain types of clients you enjoy working with?
I actually are really flexible with the the type of patients. The patient that works best uh in a video setting, which is what I'm doing, are the
Mhm,
mild to moderate patient that are motivated. So I enjoy working with them and seeing their healing
mhm,
more. Um, the type that have more, the type that harder are the people with actually chronic medical issues that are suffering a lot, and that get worse eventually, kind of like the palliative care type.
mhm, mhm, mhm,
Uh, uh, those are the one tough because I can see that therapy helps them a lot, but they can't get much better because they're dying.
mhm, mhm,
Of course, for some, they may have epiphany of acceptance,
mhm,
but it's
mhm.
hard. It's hard. Yeah. So those are harder. Yeah. Yeah.
Yeah, for sure. And I mean, those, clients who are going through in the moment through a trauma and like palliative care and dying and those kinds of things, they kind of need to be held. Not, we call that talk therapy and
Uh-huh.
empathy.
Uh-huh.
And some of us as clinicians were kind of more task oriented, and that's why I love seeing such a variety of people to interview, like yourself and some of the other people we've had on, Lorraine, and different ones. So I think that's we knowing as a clinician where our skills are best suited helps our clients immensely, and we can refer out when it's not as good a fit. I think that's actually really helpful.
Yeah, my favorite type maybe like panic attack and phobia because I have myself a lot and
Right.
because of Team CBT and also my experience working in a medical clinic, I see a
Mm,
lot of them. Uh, and you can see them get here really fast. Yeah. Like sometimes some of the patient, like the same session, they get a lot better. Yeah. Yeah. Like in terms
that's
of panic attack and phobia, of course,
sure.
they are the little more minor mood issues
Mhm.
or uh, but, but yeah, so those are very satisfying. But then I also learned that part of it is my ego too. Like also, yeah, I can
Feels
get them
good when they
better
recover like that.
like that. So I'm learning to remember that uh, not get my ego involved. Yeah, yeah. But it's still good to see them. They're getting better. Yeah.
Oh, for sure.
Yeah,
Feels good.
and now, yeah, because I know some patients have panic attack for years and they don't
Mm.
get better. And I just saw them like one or two times and they said, "Oh yeah, I'm no more panicked." I said, "Well, what happened before?" And so it's kind of sad. Yeah. And I was like relatively new clinician at that time when I was in the medical clinic. So I don't think it's the skills, it's just certain techniques that I use. Well, probably maybe my experience too. I can do a lot of
Yeah,
empathy and all that
yeah,
stuff.
for
Yeah.
sure.
Uh,
I think you're right on there, because your one of your skills would have been that you did personal work, right? That, I mean, that would have been
yeah.
a skill you brought to the table for sure, is because you did this on yourself. And I would say that you were saying you like to work with mild to moderate. I imagine our viewers and listeners might be like, well, panic attacks sound pretty scary, and phobias, I mean, isn't that on the extreme scale? But what you're saying, if I'm hearing you right, and correct me if I'm wrong, is that the reason they're kind of mild to moderate is because they're quite easy to have that recovery. Like you said, sometimes, not always, we can't promise
Uh-huh.
it, but sometimes even in one session.
Oh yeah, yeah, yeah. I have a patient who uh couldn't go to any close place, and he talked to the doctor, and then same day, like the next after the doctor know is more about phobia and panic attack, she sent him straight to my room because I have an open session. and because of his insurance, he's low income. I can the hospital could only see him one time. So I
Mm.
said, hey, there is actually a technique called exposure that can work. Uh, but because I can only see you one sessions, I want to kind of help you with that. Uh, and then I say, do you think you want to get better? He said, oh yeah, right now I couldn't go to Disneyland or movie with my kids, and I feel very ashamed and all that stuff. I can do a lot of work. So I said, okay, well, sounds like you're very motivated. I don't even want to do all the other work. So why don't I just close this door, tie your arm, and turn off the light, and then I'll be back in 30 minutes. Do you think you
Oh
can do
no.
that? And then, of course, I explained to them the curve
Sure.
and all that stuff. And he was very motivated. And because he was motivated by his love of family and connection with his family, not just to feel better. I think it's important. I think there are more important motivation. So then I was sitting outside and my colleague, my doctor said, are you done with him? I said, no, 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 I'm doing my work right now. Yeah. So I was just like doing other stuff. And then 30 minutes later, he got better.
Wow.
And then I didn't hear from him again. Because he couldn't really visit the medical office because of his status. But a year later, the same doctor told me, "Oh yeah, I saw so and so," and he said, "Can you make sure you thank Sunny because now I can go out and my life changes, uh,
Mm.
and and I can." Go out with my kids and we went to Disneyland and all that stuff. So yeah, so that was very satisfying. Uh, like what you say, I have to remind myself that okay, don't do it for the ego. Yeah, but I think for the purpose of compassion and love and helping, I think that's also good. Yeah, yeah.
Yeah, what a great story. Well, we're out of time already. Ah, so fast, it goes so fast. I mean, before I ask the last question, I wanted to say that that anxiety curve that you mentioned, I love that, and maybe I'll pop it on the screen for people. You taught me that in Tuesday group, and
Oh,
I use that all the time now when I'm teaching anxiety or when I'm doing it with a client. So that was really helpful. So our last question is always in if every clinician, therapist, doctor, psychiatrist was listening to this podcast or this YouTube video right now, what's one thing about team you'd like them to know?
team is TEAM. You don't pick them apart.
Yeah,
So you have to do them all. Yeah, and that's
yeah.
why it's
I love
useful
it.
because by itself other techniques have it too, yeah. But TAM is a whole thing, yeah. So you have to do them all. Yeah.
Well, thank you so much for being here with us, Sunny.
Okay, thank you.